Folivane-Ob is a combination of multivitamins and iron that is used to address vitamin deficiencies caused by a lack of proper nutrition, certain medical conditions, or during pregnancy. Vitamins and iron are essential for the body, and taking Folivane-Ob can help maintain good health. It is recommended to take this medication as directed by a healthcare professional, usually once daily with a meal. It is important to follow the recommended dosage and timing for optimal results. When taking Folivane-Ob, it's best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all the directions on the product package or as directed by your doctor, and not to take more than the recommended dosage. If you have any questions, be sure to ask your doctor or pharmacist. For the best results, take this medication on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water, 8 ounces or 240 milliliters, unless your doctor tells you otherwise. If you experience stomach upset, you can take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. After taking the tablets or capsules, try not to lie down for at least 10 minutes. If you have any questions about your particular brand, be sure to consult your doctor or pharmacist. If you are taking the delayed-release form or extended-release capsules, be sure to swallow them whole and not to crush or chew them. Doing so can release all of the drug at once, which can increase the risk of side effects and decrease absorption. Also, do not split extended-release tablets unless they have a score line and your doctor or pharmacist tells you to do so. Remember to take this medication regularly in order to get the most benefit from it, and try to take it at the same time each day to help you remember. If you experience constipation, diarrhea, or upset stomach, these effects are usually temporary and may go away as your body gets used to Folivane-Ob. However, if these effects persist or worsen, contact your doctor or pharmacist. Iron in this medication may cause your stools to turn black, which is a harmless effect. Your doctor has prescribed this medication because the benefits outweigh the potential risks. Most people using Folivane-Ob do not experience serious side effects. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not mentioned here, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. It's important to note that accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Therefore, it's crucial to keep Folivane-Ob out of reach of children at all times. In the event of an overdose, it's important to seek medical help immediately or call a poison control center. As for the best time to take Folivane-Ob, it is recommended to take it at the same time each day to help remember. The daily dosage will be determined by your healthcare professional based on your individual needs. Remember to follow their instructions carefully to ensure you are getting the optimal benefits from this medication. Before taking Folivane-Ob, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a medical history of certain conditions such as iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, it's important to inform your healthcare provider if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's also important to inform your doctor about all the products you use before having surgery. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. When taking Folivane-Ob, it's important to be aware that it can interact with other medications. This means it may affect how those medications work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Folivane-Ob can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of Folivane-Ob. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know that you are using Folivane-Ob. If someone takes too much Folivane-Ob and experiences severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It is important to take the correct dosage of Folivane-Ob to avoid these symptoms. The recommended daily dosage is, insert dosage here. It is best to take Folivane-Ob at, insert optimal timing here. This medication can provide several benefits for your health, including, insert benefits here. Always consult with a healthcare professional before starting any new medication. If your doctor has prescribed Folivane-Ob, it's important not to share it with others. Remember to keep all medical and lab appointments while taking this medication. Some brands of Folivane-Ob may also contain ingredients such as docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to note that Folivane-Ob is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take Folivane-Ob on your prescribed schedule, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Take your next dose at the regular time. Don't take double the dose to make up for the missed one. When it comes to storing Folivane-Ob, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place, away from children and pets. When you no longer need it or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Remember never to flush medications down the toilet or pour them into a drain unless instructed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.